Hi, this is Daniel DiTuro. Do you believe wearing a mask infringes on your freedom and rights? In this video, I'll share information about wearing a mask and civil rights, how to skew statistics, what part of personal protection don't you understand, and are outside influences inflaming division? To live in a civilized society, you give up part of your freedoms and rights. Some people believe laws and executive orders don't apply to them. On June 21st, 1788, 13 loosely united states ratified the U.S. Constitution, replacing the Articles of Confederation. The preamble begins with "We the people of the United States of America." The goal of the Constitution was to establish a more perfect union. Not a perfect union, but a more perfect union. The U.S. Constitution created a democratic republic with a stronger federal government while still preserving state and individual rights. The Great Seal of the United States and every coin has the motto E pluribus unum, Latin for one from many. Over the past few decades, the motto has been more like E pluribus pluribus, many from many. Instead of uniting for the good of the country, focus has shifted to the good of the individual or corporation. I worked at a large corporation that started a political action committee to fund candidates that shared the views of the company. The PAC's goal is electing candidates for state and federal office who supported what is good for the company. There will always be division and disagreements in any society, but the internet and social media gives like-minded people and companies a way to communicate and mobilize a large number of people instantaneously. The 21st century is becoming an age of false and misleading information. The 2020 global coronavirus pandemic is not rocket science. Deadly bacteria and viruses have existed for millions of years. For thousands of years, millions of people died from contagious diseases that are curable today. Before the discovery of antibiotics and antiviral drugs, there was little anyone could do but provide comfort and support. There's been a lot of confusing and misleading information from politicians placing a bull market above public health. Wearing a mask when sick with a contagious disease or to prevent illness has nothing to do with a person's rights or freedoms. It's a moral responsibility for living in a civilized society. We live in an electronic world of data and statistics. As of December 18, 2020, there were over 310 confirmed COVID-19 related deaths in the U.S., if you believe the data. With about 4.5% of the world's population, the U.S. has about 23% of total confirmed infections and 19% of global deaths. The U.S. quickly became the world leader in both confirmed infections and deaths just months after the start of the pandemic. In August 2020, President Trump used CDC data to prove the COVID-19 death toll was inflated. Less than 6% of the deaths were actually due to COVID-19. It's true the CDC released data that 6% of confirmed COVID-19 deaths were due to COVID-19 alone. That doesn't mean the other 94% did not die from COVID-19. It means of total deaths, only 6% of confirmed COVID-19 deaths were people with no pre-existing conditions like diabetes, heart disease, obesity, kidney disease, etc. Millions of Americans, many at high risk, have one or more pre-existing conditions. It ranges from an estimated 37 million with chronic lung disease to 100 million who are overweight. Pre-existing conditions may partially explain why the U.S. leads the world in COVID-19 deaths. Some Americans also believe the elderly should not be included in the death toll because old people die every day. To insist 94% of COVID-19 deaths are due to pre-existing conditions and not the coronavirus is like saying a person died of obesity and diabetes instead of pneumonia caused by influenza. Most people are not admitted to a hospital or placed in intensive care due to obesity or diabetes. Patients are admitted to a hospital due to complications brought about by obesity or diabetes. Airborne viruses and bacteria are spread by people in close contact, not by people who are isolated. After the initial lockdowns were over, thousands of people gathered together to flood their bodies with immune system suppressing alcoholic beverages. Forget the old wives' tale about catching a cold or flu from exposure to cold air or water. People become infected by airborne viruses and bacteria by inhaling the germ, regardless of the temperature. While people of all ages have died of COVID-19, the majority of deaths have been people aged 65 years and older. That's typical, even during a normal flu season. As we age, the immune system is less effective. Add pre-existing conditions like diabetes or heart disease, further complicates fighting and recovering from a serious infection. You can blame the high COVID-19 death rate among the elderly on pre-existing conditions and a weakened immune system, but eliminate the virus and most elderly victims would be alive today. As I've shared, as of December 18, 2020, over 310 Americans have died from COVID-19. That makes it the third highest death rate behind heart disease and cancer, and 2 to 7 times higher than other leading causes of death. Among the guidelines given for limiting the spread of the virus is wearing a mask. Unlike many Asian countries, most Americans are not used to wearing a mask in public when ill or to reduce inhaled pollutants. Even before the coronavirus, millions of uninsured Americans with no sick leave went to work or school while contagious. Some Americans have made it clear they preferred catching the virus and possibly die to being forced to wear a mask. After all, the coronavirus is not the Black Death that killed up to 200 million people during the 14th century. This is the 21st century, not the 14th. We know what causes plague, colds, flu, and other contagious diseases, and how to contain them. While the risk to healthy young and middle-aged people is low, many are contagious and asymptomatic, placing vulnerable people at risk. Would you stay in close physical contact knowing someone is infected with a highly contagious disease? Do you take pride knowing you can infect dozens of people, including people at high risk of serious illness or death? Some Americans believe they have no moral responsibility, even in a pandemic, to wear a mask in public. Masks provide two-way protection. They protect the wearer and the people they come in contact with. Many jobs require wearing a mask. It's about employee safety, not corporate infringement of an employee's rights. Masks are part of PPE, personal protective equipment. Masks protect workers from inhaling dangerous chemicals. Masks protect patients and surgical teams from contagions. Are you comfortable with your surgeon or surgical team refusing to wear masks? Foundry workers wear PPE while working with molten metals. Firefighters wear PPE to prevent inhaling toxic particles and fumes. Do you know most fire-related deaths are caused by smoke inhalation? Smoke from wildfires can cause chronic respiratory illness, or permanent lung damage. Satellite assembly workers and test technicians wear PPE to protect mission-critical space hardware. Would you walk in space without PPE because it infringes on your rights? Are you ready to stroll on the surface of Mars without PPE? You don't need to be an astronaut, surgeon, firefighter, or work with dangerous chemicals to understand the need for PPE. A simple mask can protect you against a variety of unseen hazards, including bacteria and viruses. PPE reduces your risk of injury from visible and invisible hazards. PPE protects your eyes, hearing, lungs, and more from serious or permanent injury. You can be macho and not wear PPE, but it's too late after you've been permanently injured. Millions of people live with total blindness or vision in only one eye. With email, text messaging, and signing, you can still communicate after losing your hearing. People live long, productive lives with missing fingers, toes, arms, and legs. Many stores provide complimentary scooters for people with limited mobility. Unlike PPE that prevents personal injury, wearing a mask can substantially reduce the spread of contagious diseases. Instead of leading the world in infection prevention and having the lowest death rate during the pandemic, the U.S. quickly led the world in both infections and deaths. Vocal American opponents to wearing masks and social distancing found plenty of support on social media. Thanks to the anonymous, unregulated internet, most Americans have no idea who's supporting them. Why should a nation invest billions of dollars on military hardware when they can use social media and a simple biological weapon? The novel coronavirus spread to most major U.S. cities within weeks and practically shut down the economy. While investors are having a fantastic year, millions of Americans have lost their jobs, healthcare coverage, and more. Developing, distributing, and administering a vaccine against a new virus would take more than a year, and there may be no cure against a deadly new bacteria. Instead of sending the world a strong message that the U.S. is prepared for any biological attack, some states, the federal government, and thousands of Americans are sending the opposite message. While you may be invulnerable to the coronavirus, think about the people you care about who are not. It takes cooperation, not resistance, to stop an epidemic or pandemic. Please leave a comment if you have any questions about this video. Thank you for watching.